Okay, cool. Hi everyone. Welcome to this February's dialogue session. Um, so, uh, uh, yeah. Every month, third Wednesday of the month, 5 p.m. Hawaii
Okay,
time,
one more.
we always meet and have kind of someone come in and give a talk that can help with your career or present research. If you're interested in giving one of these talks, feel free to email us at info@honuascholars.org. We have a lot of um, talks scheduled for the coming months. Next month, we actually will have an unrecorded discussion about some of the changes in federal DEI policy and how that affects different programs and research around the academic community. But today we are welcoming Michelle, who will be talking to us about medical school. And this meeting will be recorded and available on YouTube. So feel free to use like the chat boxes or leave your camera off if you don't want to be seen or recorded. But yeah, welcome everyone, and we hope to see you at future sessions. And I'll hand it off.
Yeah, thanks, Kyle. Hi, everyone. I'll introduce myself in a second, but before we begin, there are a couple things I wanted to mention. One of our sponsors is the Native Hawaiian Center for Excellence, and there are a couple of programs they wanted to plug to you guys. So the first of these looks like, and I'm just looking at this now. I think Kyle's going to drop the links in the chat as well. So if any of you want to check them out, but they're pretty pertinent to today's talk. This one is, I think, like, let's see, a 6-week program for pre-med undergrad students. Looks like it's UH. And then let me just, if I could click to the next one. Um, this is looking like it's a week-long summer program, so a similar thing for pre-med students who are interested. Both look like good resources, so definitely check them out if this is something you're interested in. And with that, I'll introduce myself and we can get into it. So, hi everyone, my name is Michelle Murata. I'm currently a third-year student at NYU, so it's been pretty cold here. It's been like 20 degrees, but we're rough in the winter here. I grew up in Kahaluu. I attended Kamehameha schools, graduated in 2018, and then I was at Stanford University for undergrad. I majored in chemistry, minored in ethics, graduated in 2022, and then started medical school that fall. So I've been at NYU ever since. I've really loved the experience. I'll try to keep it brief and go over these slides relatively quickly because I think the highest yield thing is if anyone has questions, I would love to answer them, and just tailor it to what's most helpful to you guys. So if at any point anyone has a question, please feel free to unmute if you're comfortable or drop a message in the chat as well. Kyle and I will try to keep track of that, and just make sure we're facilitating and, again, keeping this as applicable as possible. So with that, let's get started. I'm sure most of you are here because you already have an interest in medicine, but I just kind of wanted to go over briefly what healthcare even means, and what medicine even means. And of course, it's difficult to talk about healthcare without understanding what health is. And there are a lot of different definitions for health, many of them cultural. Um, at most training programs in the United States, there's a focus on physical health and medicine being based around pharmaceuticals, and physical examinations of the body and things of that nature. But there are many other components of health. There are a lot of cultural things as well. And so there are spiritual and emotional elements that are emphasized by different groups. And I just want to acknowledge that this is one aspect of health that medicine targets, especially Western medicine, but I think is integral to your health. Because if you don't have your physical health, it's really difficult to maintain those other aspects. And of course, they're all crucial, but I think this is really central to how we operate as people. In medicine, there are really a few different arms of action we have, as tools at our disposal. And the first of those is prevention. So hopefully this has been, for most of you, your experience with the medical system is routine healthcare visits, things like vaccinations, things to prevent you from getting ill in the first place. And of course, we have diagnosis. So if any of you have had anything common like strep throat, for example, there are rapid strep tests, but of course there are more sensitive tests like throat cultures and things of that nature. So we have different tiers of diagnostic testing as well that can help us to understand disease and profile diseases so that we know how to best address patients and make sure we're treating them according to their level of severity. And then, of course, we have treatment, which if you already have a disease and if it is treatable, we're able to do that. So I think like a good example of how these tiers work, like I'm not sure what level you all are at, but I don't want to put anyone on the spot and ask. But a good example is lung cancer, for example, right? We can target lung cancer with prevention. We can say we're going to minimize secondhand smoke exposure. We're going to keep kids away from parents that smoke, or try to have parents smoke outside of the household. We can try to encourage smoking cessation. We can try to discourage occupational exposures to things like coal miners, for example, those types of exposures that can cause lung cancer. But then we can also say we have many tools for diagnosis in lung cancer. We have imaging, we have biomarkers. And then if all else fails, we have treatment. So we have resection, we have chemotherapy, we have radiation. Sort of an example of how those different points of medicine interact. And I think one of the things I love most about medicine is it's extremely interdisciplinary. Yes, everyone thinks about medicine as you have to learn the biology and you have to learn the biochemistry. But really, those are basic guiding principles. And clinical medicine is very much applied science. Day to day, I'm not thinking about cell biology, which may be a good thing or a bad thing, depending on your interests. But I'm not thinking about the chemistry I learned in undergrad. I'm thinking about how to apply those things that I've learned as foundational concepts to what's going on in this patient's body. And these medications that we're prescribing them, how are those targeting these processes in a specific way without damaging other structures? So, yes, very much in applied science. We also get to apply other things like new technologies. Now that AI is such a thing, AI in medicine is controversial. People have different reactions to it. But I think the most optimistic view and hope is that AI can be leveraged to make processes more efficient, to free doctors up to deal with the more humanistic aspects of medicine. So that instead of spending time transcribing notes and doing other menial tasks, doctors can actually be with patients at the bedside. And AI can be taking care of those other processes and streamlining them. And then clinical practice. This is really what I mean when I say the humanistic aspects of medicine. These are things that we as people can do best. It's being there and holding someone's hand when they're going through a cancer diagnosis. It's breaking bad news. It's being able to help a patient navigate a difficult process, even when you and the patient aren't aligned on what the next best steps for their care are. So I think for all of these reasons, medicine is very complex. It's very interesting, and it's ever evolving. And some of the roles and responsibilities I already mentioned. I kind of briefly mentioned empathy, of being at the bedside with someone, but there are a lot of other layers that are really necessary to having a successful patient-physician relationship. One of those things is honest communication, and it can be difficult, especially when selfishly you're delivering news that's difficult or unpleasant for you to convey to the patient. But a central part of having a strong physician patient relationship is giving the patient all of the information that they need in order to make an informed decision. So, medicine has changed a bit. In the past, definitely, there was more of a paternalistic relationship between physician and patient. What I mean by that is the doctor would decide this is what's best, this is what's standard of care, and sort of guide the patient through that process. But now what we do as physicians is we educate patients first. And what I mean by that is, right, you can be as honest as you can be, but if the patient doesn't understand the terms with which you're communicating, that's a pretty futile effort, right? So if I'm telling a patient like you have cholangiocarcinoma and they don't know what that means, it doesn't matter that I was able to communicate that honestly. I have to explain to them, okay, well, this is a cancer that maybe doesn't have a great prognosis, that's located in your digestive tract, specifically in your biliary system, and to be able to help the patient understand what that means really and how that's going to impact their day to day life. And only then, when you have both honest communication and a clear explanation of what that means in terms that are understandable to the patient, can you then have shared decision making. Um, And so what shared decision making is really coming alongside the patient, determining what their values are, right? What's important to them. Do they want to live a long life? Do they want to live a life that's just at home with their family with the time they have left? And most of the time, right, we're not making these palliative care decisions at the end of life. Most of the time, it's like, do you want to go back to work now, or do you want to like wait a couple of weeks? So it's mostly more benign, but those decisions, regardless of what level you're making them at, should be shared decisions. And compassionate care. I think it's really easy to get caught up in the machinery of medicine, to just go through the motions. And I'm just a medical student, but it's the hours are long and it's busy, and it's easy to just sort of go task to task and forget about the people that are experiencing these things. And so I think being mindful of patients, their emotions, and their experiences is really crucial too. Hence compassionate care. And the last thing, which I think gets overlooked a lot, especially as students, we're always looking toward not having to learn anymore, I think, to an extent, or at least that's how I sort of conceptualize things when I was in school. I was always like, I'm learning, I'm jumping through all these hoops, but then one day I won't have to jump through any hoops anymore, and I'll be established and I won't have to learn anymore. But I think what makes a good physician is someone who is a lifelong learner. Like I mentioned before, medicine is constantly evolving. And if you're not keeping up with literature, if you're not reading up on the science, if you're not understanding what new innovations and technologies are coming out, you're not going to be able to offer cutting edge care to your patients. And so it's really important as physicians that we commit to knowing the best practices in the field and being able then to communicate those to our patients so that they can make the best decisions for themselves, and their families as well. And then I think for most of you, I don't have to convince you of the importance of healthcare, so I won't spend that much time on this slide. But there are a lot of different ways in which healthcare impacts society. Of course, there are public health initiatives, things like um, passing policies that promote healthier lifestyles, or making healthcare more accessible through things like more free clinics, et cetera. But also ways to, I guess, apply the different values that you have as a person, but to see those reflected in society. So, for example, healthcare isn't equally accessible to everyone. One of the things I like most about training at NYU is we have a public and a private hospital right next to each other, just a few blocks away. And the care that those patients receive can be very different depending on the physician they see, depending on the type of insurance they have. So, equitable healthcare is also a way in which doctors can really push to see justice in society, and to get better care that their patients deserve. And then ultimately, I think the goal is we want people to live good lives, right? Like I was in clinic with a physician last week, and he said to a patient, "I don't want you to be held hostage by the medical system." And I think that's really insightful because a lot of times we see patients and then they recover, but it's like we want to continue having maintenance visits. And I think that's really not the goal of medicine. I think the goal is to see people, treat them, and send them back out so that they can live their lives fully and carry those lessons with them so that their families can be healthier for generations onward. So ultimately, if healthcare works, it means less money for doctors, which is a separate conversation. But I think currently our system isn't really set up that way. And so that's definitely something to think about too. And there are a lot of different branching points in medicine when we're thinking about, your future career and what it could look like. You could have a clinical career or you could have a surgical career. I don't know what you guys know about medicine, but I know when I entered, I didn't know very much. I don't have parents who are doctors. I don't really have doctors in my family. And so I didn't realize that depending on what specialty you choose, your practice can look really, really different. If you enjoy working with your hands and you enjoy procedures, surgery is the way to go. If you are like, I love talking to people all day, I want to write notes and document it well, maybe clinical medicine is more for you. You can also select specialties based on your patient population of interest. So, whether you prefer to talk to kids, or whether you prefer to work with kids, or whether you prefer to work with adults, or you could even go into geriatric medicine where you're working with older individuals. Um, And the setting as well can be customizable. So you can decide you want it to work outpatient mostly or inpatient. To clarify, outpatient means these patients are not admitted to the hospital. So these are patients who come to like clinic for a checkup, or even patients who get same day surgery and are sent home that day. Versus inpatients are people who are actually admitted to the hospital. And last, you can really figure out what it looks like in terms of, do I want to be associated with an academic institution? Do I want to go into, you could have like a professorship or an assistant professorship as a physician in more academic practice, as opposed to going into private practice, where you sort of rent out a space in a hospital, maybe, or have a practice with other physicians and can kind of dictate your own hours. So there are a lot of different ways you can go. And depending on what you choose, a lot of possible ways your career can turn out. And now this is kind of the part that feels most relevant, I think, to most of you who I'm assuming are pre-medical students, is all of the steps along the way that need to be taken to get into medical school, which sort of at this point might feel like an endpoint to you. Um, you've all probably, I'm assuming you're all college students or around that age, but if you are, you've undergone a lot of these steps already. You've had to do standardized testing, whether the SAT or the ACT. You've had to have good grades in high school in order to get into your college of choice. You've had to participate in extracurriculars and demonstrate leadership and all of those other things. They don't go away for medical school applications. And in fact, many of the same things apply. Instead of the SAT, we have an exam called the MCAT, which is much longer, unfortunately. I think at this point it's probably 7 to 8 hours. But it tests you on physics, biochemistry, biology, of course, a bit of chemistry, and also some reading comprehension. And that's an exam that has a score and is sent to your medical schools when you apply. I do want to clarify something really quickly because I've been getting a lot of questions about this recently, just from other students I've mentored, um, about whether or not they can take the MCAT multiple times. And typically it's people coming to me after they've taken the MCAT once and they have a question about retaking it. I just want to put this disclaimer out there. The MCAT is really only meant to be taken once. It's not like the SAT where you can pick your best score to send. Medical schools can see every attempt. And because the test is so expensive and so time consuming, I would really recommend planning for the one attempt to be your only attempt. But in addition to standardized test scores and stats, there are, of course, other components of your application that are equally, if not more important, to making you stand out as an applicant. And so those are, of course, letters of rec. If you have any extracurriculars or research, for example, that could make you stand out, as well as clinical experience, which I think is really crucial. It's difficult for you to have credibility as an applicant to medical programs if you haven't demonstrated familiarity with the medical world, whether it's volunteering, working in a hospital, you have to have some sort of touch point. And so I think even getting FaceTime in with a physician and shadowing could totally fulfill that. And as for medical school itself, which is the phase I'm in now, it is variable. I really wish I could tell you this is how it goes for every medical school, but it's pretty program dependent at this point. That being said, the same phases exist across all programs. And so for everyone, you start off with a preclinical curriculum, and this varies in length. At my program here at NYU, it's 1 year preclinical, which is relatively short. I think Harvard has moved to like 1.5 years. They were previously 2 full years. Duke has been 1 year for a really long time, but they were kind of early. So most programs are about 1.5 to 2 years, anywhere in that range. And for preclinical years, you basically do what you did in college. You have a professor up there lecturing you about kidney physiology for an hour or 90 minutes, and you take notes, and then you have an exam, and then that's your year, is basically learning through didactics. I think the real rewarding part of medical school comes with clerkships. For those of you who aren't familiar with clerkships, this is when the clinical portion of your medical school training really begins. And during clerkship year, you get to see all of the specialties. So different schools have slightly different specialties they rotate through. Here at NYU, we rotate through pediatrics, OBGYN, neurology, psychiatry, surgery, and then medicine, of course. And so you generally have the most popular, the biggest, the broadest specialties, and you get to rotate through and get experience with all of them. And that's fantastic because it's really your first opportunity to work with students, to take ownership of your learning and to apply it in a clinical setting. You are able to integrate in with the clinical team and really become one of the providers, quote unquote, on the team. So I think clerkship year is a huge transition point, and really the first point at which you go from feeling like a medical student to feeling more like a doctor. And then I have my screen shared, so I can't really see my last point, but after clerkship year, you have more advanced courses and electives. And so for us here at NYU, that starts in third year. For some schools, that starts maybe in later in third year and fourth year. But at this point, you're more specialized. And so you start to choose what courses you want to take. For example, I've been on surgical electives for the past few weeks. So I was on ear, nose, throat surgery the past 2 weeks, and now I'm on plastic surgery. Versus my classmates who are maybe wanting to do psychiatry or peds have been doing peds electives or psychiatry electives. So you really tailor your schedule according to what you want to go into at that point. And then my last point was just boards exams. You don't really need to know anything about this, just that there are standardized exams that you do need to pass when you're in medical school in order to graduate with your MD. Really not important. You could spend all your time up until medical school having no idea what these exams are, and it's completely fine. But standardized tests do not completely go away once you're in med school. And then residency. I didn't really know much about residency when I started here, but residency is basically, this is after the point at which you have your MD. And so you're a doctor, but you're not a full-fledged doctor in the sense that you require supervision. You don't have your own license under which you're practicing. And so you report to a senior doctor who we refer to on the team as the attending physician. And the attending physician sort of checks your work. They make sure that you're putting in patient orders correctly, that your diagnoses are on point, that the plans for care you're making align with their own expertise. So really kind of the liability for any mistakes that are made fall on them. But what it creates is a really nice training opportunity for you, to spread your wings, to practice independence, and to develop your own practice as a physician. And it's the first time in your training where you're really doing specialty specific work 24/7. So for example, and residencies really vary in terms of their duration. Some of them can be as short as 3 years for internal medicine, and some of them can be as long as 7 years for neurosurgery. So I have a list of specialties there. Those are just examples of specialties that have different lengths of residencies, and it varies a lot. And I just wanted to finish up by talking about some challenges in medicine and some rewards. Um, I think it's important to keep this in mind, not because I'm trying to deter you at all, but just to be realistic about what you want in life, and what you envision for work and how that will play into balance with other aspects of your personal life. So, a few things here about medicine in general are the hours are pretty unpredictable. Sometimes you're on call, sometimes you work way later hours than you expect. You're really at the beck and call of the hospital and of your team. And I think that's what makes the dynamic so unpredictable is you're part of a team now. And sometimes your colleagues call out sick, sometimes they ask you to come in earlier, and it's pretty difficult to say no to those things. So you end up moving your schedule around quite a bit. Um, the hours are pretty long as well. As a medical student who's a now like a more advanced medical student, my hours have definitely increased. This morning, I got to the hospital at 4:50, and I got out today at 6 p.m., which was earlier than I normally get out. I normally get out around 8 p.m. So those are surgery hours, of course. But for most of my classmates, it's not a normal 9 to 5. They get into the hospital at 7 a.m. and they leave maybe around like 5 or 6 p.m. So that's pretty normal here in medical school, even before you've started residency. And that's 5 to 6 days a week, depending on what team you're with and what rotation you're on. Um, and then I can't see like what the last couple bars are written on my slide because of the way this is formatted. But other than long hours, it can be difficult with potential burnout. A lot of people find that the emotional toll that talking to tons of patients about their conditions, hearing lots of complaints, and just about their difficulties and trials during their experience with the medical system, that definitely leaves a mark. And I think for a lot of people, they take that home with them. It can make them really miserable. And so it's important to make sure you know how to take care of yourself, whether that means you need to go to the gym a few times a week to unwind, whether that means you need to call friends and family to de stress. You need to kind of have some self awareness and know what those things are so that when you are challenged during medical school and during residency and during your attending shift, you know who to go to and you know what releases that you have. Because ultimately, you can't be an effective healthcare professional if you can't take care of yourself. And I think I touched on some of these already, but I think in terms of managing work life balance and keeping a balance, I think communication is key. I know I already mentioned the long hours, the unpredictability. If you are planning on having a future with maybe a spouse or kids, which most people in medicine have, and it's not a problem, but it does take some special accommodation. It takes for sure communication and just an understanding and a setting of expectations about, I maybe won't be able to make this dinner because my hours might run late, or I know I said that I would be available for X, but I'm going to have to cover for my classmate or colleague on this day. Just really open communication, I think, is helpful for making sure that you're able to balance your personal life with your professional life. That being said, I don't think these sacrifices always need to be made. In the short term, there's definitely more of putting your personal life on the back burner, um, whether it being during clerkships or advanced rotations in medical school, um, or whether it's during your residency, which might be 3 years or it might be 7 years. Ultimately, there should be a light at the end of the tunnel where you're able to, as an attending or as a senior resident, dictate what your hours look like more so and have more agency when it comes to your schedule and when it comes to planning social events. So there is definitely an end, but you have to sort of decide for yourself where your boundaries are and how long you're willing to quote unquote stick it out during residency. Because again, those hours and those the number of years can be really variable depending on what specialty you go into. And last, like flexibility is key because there are going to be times I know I've known residents who have planned to have kids at a certain time. It doesn't work out in terms of like I knew one resident she ended up having kids earlier than expected, couldn't take maternity leave, had to go back to work 2 weeks early. That's a really extreme example, or 2 weeks after she had her twins. That's a really extreme example. Another pretty extreme example is COVID, when physicians were called to come to the hospital to really man the fort, and as a result had to leave their families because they were unsure of the progression of this new, pretty unknown disease. So, for all these reasons, and I think just because of the social calling that comes with medicine and the obligation to patients, you do have to be flexible and you do have to communicate pretty well with your loved ones. And then some of the nice things about medicine, you aren't paid tons as a resident, so as a trainee. You're definitely paid nothing during med school. But as an attending, you will have a livable wage. And no matter where you practice, salaries adjust pretty well according to the region. And so that's never really an issue or a point of concern, which is lovely. I think also job security is a huge thing. I have a lot of friends who worked for Facebook or like had other software jobs who were just laid off at a moment's notice. And that doesn't really happen in medicine. Fortunately, there's a lot of, well, sadly, there is a lot of need, but fortunately, it generates a lot of demand for healthcare professionals, specifically for physicians. Our population is aging as well. Diagnostic tools are improving and treatments are becoming more effective. which means there are more people living with chronic illness, and those people require more healthcare professionals, and just more hands on deck long term, which is where doctors come in. Additionally, if you're working in a rural area or even think like outer islands in Hawaii, there's tons of need for specialists. Like people might not have an eye doctor, and have to drive like, I don't know, 3, 4 hours in some places of the country just to get their eyes checked out. So I think if you're wanting to go into a more specialized field as well and interested in living in a rural area, you'll definitely find that lucrative, and that'll definitely be possible. And then I think the most important thing is just acknowledging the fulfillment that comes with medicine. This is a cliche for sure, and people talk about it a lot. I think when doing medical school admission interviews, everyone talks about, I just love taking care of people, or it's the best way I could be spending my time. And I don't think those are bad answers because I think they're true. I think there is a lot of appreciation that comes from our patients, and that can be really gratifying to see when a patient thanks you for walking alongside them during a very difficult time in their life, or even just thanks you for explaining something that was confusing to them in normal terms so that they now feel like they have a better grasp on their health. Those things are really great and make it worth it, make the long hours worth it, and a lot of the difficult moments as well. And I think generational health is a big thing, teaching people not only to care for themselves, but to care for their parents, to care for their children, and to pass those lessons along so that they can do better in the future, and avoid similar fates for other people down the line. Another big one is community service. Medicine is a great way to serve people around you, especially in Hawaii, where there is definitely a need. There's definitely a population of homeless, for example. And there are a lot of free clinics I know that happen on Oahu where people are able to participate in community service. And if you have these skills as a physician, you can be a more effective servant leader in your community. Education is huge too. If you ever like, I love to become a teacher, but I'd love to become a doctor, and you can't choose, you don't have to. There are many educators who go into medicine and then end up, or people that go into medicine end up becoming educators long term, where they end up becoming attending physicians and so teaching residents along the way, or even becoming associate professors, and teaching undergraduate, and medical students. So there are a lot of different opportunities to be educating people, even within the field of medicine, if that's something you're interested in. And research is a huge one as well. It could be basic science research, like leading a lab. You could pursue an MD, PhD, where you're definitely doing tons of research, or it could be leading clinical trials, and other types of clinically applicable research where you're showing outcomes and how a specific technique improves patient outcomes and so on. There are so many examples of that, but research is definitely a huge thing. And I would say most physicians who practice at academic centers are really, really involved in research and have active labs. And the last one is just leaving a legacy. I think there are so many older physicians I've talked to where they have hundreds of patients whose lives they've touched. And then those patients' kids come to them and thank them. And that's something I think that you don't see in other fields, where in medicine, you have the opportunity to impact people not only on a personal level, but also have that societal impact at the same time. You have that face to face connection with your patients, but at the same time, you can concurrently be doing research, participating in trials, developing technologies or policy that affect people all over the country. And so, for all of these reasons, I think medicine is great. Would be happy to answer any questions you guys have. That's all I had planned. So if anyone has any questions, feel free to put it in the chat, um, or just turn on your video and unmute.
We'll do that. Thank you very much. It's like I'm echoing Mahalo. My name is Manning Tate. Thank you for sharing your perspectives. I really appreciate that. A lot of my students are interested in going into medicine. So sharing the just really well organized, I think the real kind of the reality of medicine. I worked in emergency medicine, my partner is a physician, and it's what you see in ER and movies, and even what you kind of when you know some basic perspectives. I think they just it's not really the real world. I think like you mentioned, doing an internship or shadowing someone or really finding out if it's really what you want to do is super critical. But I just want to say thank you for sharing your time and your perspectives today. I really appreciate that. And where are you now? You're a med student at where? At
NYU.
Awesome. Congratulations.
Thank
And
you.
what year are you? I'm sorry, I came in a few minutes late.
Oh, no, no worries. I'm a third year.
Awesome. Now that's great. And you're coming to Hawaii to practice, right?
Absolutely. Yeah, that's the plan.
I taught some of the people on this presentation. I'm really proud of them and all you guys. So you give us hope. Thank you.
Thank you. Appreciate that.
Yeah, thanks for your presentation. I'm Rika Suzuki. I'm a practicing local adult and geriatric psychiatrist. I did go to JABSOM for med school, and I just wanted to shed some light from a different perspective. I caught sort of the tail end of your presentation as well. Medicine has definitely evolved over time since I was a med student. And, I think you guys are coming about in a good generation with AI technology. Some of the inefficiencies of medicine are probably the things that make our work so difficult no matter what specialty you're in, but especially like my specialty, we chart a ton. And so EMR and these things do contribute, efficiency in charting to work-life balance. But with this whole Medicaid, Medicare stuff, it's a really, really stressful time in medicine right now. Like today, as I speak, every morning, I'm like, what's going to happen? I work in a strictly Medicare, Medicaid population right now. So it's a very unnerving time. But, as a whole, I would totally echo medicine is like a career. You don't really have to worry about employability. But I think it's always good to be open to what you think you might be interested in, and you might stumble upon a career that you never expected, which I did for sure, like working with forensic Suboxone patients, this opioid pandemic. None of this I really anticipated. Also community psychiatry. So I went in thinking, I'll do general outpatient, but I'm working with some of the most underprivileged, which is why I'm very concerned about the times. But yeah, I think there's so much opportunity in medicine in every specialty, and the limits of AI and technology are making it very exciting. But yeah, thank you so much for sharing your perspective.
Yeah, thank you. Appreciate your perspective on AI. Always interesting to hear. I think there's a question from Kyle in the chat. So I know people are like tuning in from wherever. If you're a high schooler, would you mind raising your hand? I'm just curious how many of us there are here. Or just like doing the raise hand reaction. If there are any high schoolers. Well, anyway, I can totally answer for high schoolers. For high schoolers, if you're planning on going into medicine, that's fantastic. I congratulate you on being so motivated and knowing so early on. I certainly didn't. I would say for high school, honestly, the best thing to do to prep for potentially being a doctor in the future is to learn what you're learning now well. What you learn in high school, the biology, the chemistry, those are all really important foundations. And not only are they going to help you succeed in college, but the skills you develop along the way of learning to study well, those are extremely translational the rest of your life, in terms of developing your work ethic as a future physician as well. So yeah, study well. And getting into the college you want to go to is important for being able to go to the medical school you want to go to. So I would say focus on learning, focus on doing well and being able to go to college and hopefully the college you want to go to. And yeah, focusing on developing those skills early on. You don't have to worry too much about shadowing and all of those things. I'd say that can come later on. As opposed to for undergrads, a lot of the things I mentioned, I think making sure medicine is right for you. And for a lot of people, it's easy to go into medicine because society tells you medicine is a great career. I remember growing up, people would be like, oh, I want to be a lawyer or I want to be a doctor. And I think that's great. Those are both great careers, right? But you need to make sure that it aligns with your values. Again, it's a long road, as I mentioned, and I think it's great for learning, but maybe that's not your speed. And so, really making sure you understand what you're in for, that you enjoy what you'd be doing as a doctor. And I think chatting with healthcare professionals, physicians who have the career that you might want to have, maybe practicing in the place you want to practice, can give you a real perspective on what your life might look like, which can be extremely helpful. For things to do in undergrad to help you, I think, like I mentioned, research, extracurriculars, good grades, good MCAT. If anyone has more specific questions, because I know that's extremely general advice, please feel free to message me. I'm also going to leave my phone number at the end here. So yeah, you can text me or call me. Feel free if you have any more specific questions or about going to med school on the East Coast, since I was on the West Coast for undergrad and it was definitely a transition. What motivated me to go into medical school and keeps me going? I think what motivated me to go into medical school is I loved the idea of being able to do something where I could continue to learn what I enjoyed learning, which was science, and also people. I think people are fascinating and human behavior. And medicine allows me to learn about all of those things. But I also wanted to do something with my hands, to do something applied. So I'm going to be going into a surgical subspecialty, and I'm going to be able to do that, which makes me really excited as well. I think there are very few careers I could think of that will let me do all of those things. And what keeps me going is probably how much I love it. I'm not kidding when I say I really love medical school. It's been hard at times, but overall extremely rewarding. And I'm really having a great time. Okay. I see from Kael, choosing a specialty and how I went about that in med school, balancing research for residency apps, also desire to contribute to Hawaiian health and communities. Yeah, that's a great question. And definitely a hard one. How I went about choosing a specialty was definitely shadowing. Once I got to medical school, I thought I wanted to go into orthopedic surgery. So I shadowed a lot of orthopedic surgeons and realized I didn't like joints. And that was a really important discovery. So I think, like, if you think you want to go into something, watch it. Find physicians and follow them, and find the residents and talk to them and learn what their life looks like. Because you really don't know until you're actually on the wards, actually in the hospital, and actually seeing the way that type of medicine is practiced. I think also asking yourself, what's something I could learn about for the rest of my life? For me, one of the reasons I couldn't do ortho, I think ortho is awesome and their outcomes are fantastic, but I couldn't do it because I couldn't read about shoulders and knees for my entire life, and I didn't find it quite interesting enough. So find what makes you tick, find what's interesting, and follow that thread, because that's going to be important for the rest of your career, and keeping you motivated. And then last thing, balancing research. That is hard. Balancing research has definitely been difficult in medical school. I will say, as I'm doing surgical rotations, I'm not doing very much research. When I was doing clerkships, I was doing research, but very intermittently on the side. I'm actually taking a research year, like a dedicated research year coming up between my third year, and when I'll apply in my fourth year. So that'll be a nice dedicated time. I think for more of the competitive specialties, it is important now to take a research year or to take dedicated research time to make sure you can fill that research requirement. But most specialties, you don't have to have that much research in order to match. So definitely a consideration depending on what you want to go into, for sure. And also desire to contribute to Hawaiian health and communities. Great question again. I'm in New York, obviously, and so there's not a lot of work done related to Native Hawaiian Pacific Islander communities. What I try to do is find collaborators who are doing health disparities work in related communities. So I've done a couple studies with people actually back at home I connected with and was just able to help with research projects virtually. And then here in Hawaii, or here in New York, I found a couple labs with people who were doing population health, and they were doing Asian American health, and I was able to help out with those projects. So I think finding related projects and techniques can be helpful. Dr. Irvine had a couple questions. A low point in my academic journey and how I overcame it. That's a great question. I think I definitely had a low point in my academic journey in college. I would say freshman year of college. It was my fall quarter, and I bit off a little more than I could chew. I was doing too many extracurriculars, and I was taking pretty hard classes and just not studying as much as I should have. And I did not do well my first quarter of undergrad. So that was a huge learning experience and really taught me not to be so broad and to dial in on what really mattered to me, to really focus my time management. And after I did that, I was able to concentrate on the things that were most important to me, that were going to be most productive in the long run. And I saw lots of returns. So that was a really important lesson. Go-to methods for stress management. What I try to do is it can be difficult because especially when you don't have much time in undergrad or in med school, but I think I've learned in order to take care of myself, I need to work out X number of times per week. I've also called my family a whole lot. I find that calling my family and hanging out with friends is really important for stress management. For me, it's really about putting things into perspective. And if I can remind myself, despite academic stress, that there are people who care about me and I have like a greater life outside of whatever my career might look like. That's really helpful for helping me recenter and refocus my time. And then a memorable lesson I've learned from a difficult class or professor from undergrad. As I mentioned, I was a chemistry major. My junior year, I had an inorganic chemistry class with this professor I really, really loved. And I went to every single one of his office hours, and I was the only one who would go to his office hours because it was during COVID and no one went to office hours over Zoom. But I found the class material really, really interesting. And I ended up getting a B. And I was blindsided because I was 100% expecting an A in this class. And I'd already asked him to be one of my letter writers for medical school. And when I talked to him about why he'd given me a B, his answer was basically like, your heart was in the right place. We had great conversations and you were clearly learning. But when it came to, there were a lot of coding aspects of the class. And he was like, when it came to the computer science aspects, you definitely were weaker than your classmates. And so I wasn't able to give you maybe the grade that reflected your enthusiasm or like how much you thought you were learning the subject matter. So that was definitely a difficult lesson to learn, which is sometimes despite your best effort, and that was definitely my best effort in that class, you're just outmatched. People have more skills than you. People are able to outperform you with maybe less effort. And I think the takeaway from that is you can't always be the best, and it's important to learn from those moments. And for me, it meant realizing that I wasn't good at CS, or at least good in the relative sense. And I've spent a lot more time since then thinking about what are skills that I can hone, but also skills that are worth honing in the sense of they'll contribute to my practice in the future, and make me a more effective physician for my patients. So I'm taking, during the time of my research year also, I'm going to be doing a master's in bioinformatics because it's an area I'm weaker in. I don't know as many stats. I don't know coding as much, but I really want to be able to acquire those skills so that I can use them in the future in my research. So I think that answers that question. If there's nothing else, I think I'll turn it over. Oh, one more question. How did you overcome the enrollment expenses? Can it be covered by a student loan? That is a really great question. Thank you for asking that because it's very practical. And medical school is expensive, which I think is one of the things I didn't mention, but was actually one of the bullets in my Prezi. NYU, fortunately, is a free tuition school. So I didn't really have too many enrollment expenses, but I think you could talk to a lot of people and they would have insights into that. I do apologize though. I'm not entirely sure. And then Dr. Irvine again. Oh, that's just, okay. Awesome, thank you. And Kyle's asking, what's med school like at NYU? What are some fun things on the weekends and in my free time? Med school at NYU is really interesting because I'm on an apartment on 26th and 1st, and outside of my window, I can see the Empire State Building every night. It's very surreal. It's very interesting. And I would say the unique thing about going to med school at NYU, obviously NYU is great because it's free tuition, and would really recommend that to everyone if you can find it. But in addition, just being in New York in general is awesome because it's such a diverse city. You learn from so many different types of people. We have extremely upper class people. We have celebrities here, but we also have a lot of homeless people, a lot of people who are not US citizens who are seeking care. So you learn to care for everyone in society, and to just do your best for every single patient that walks through the door. And I think that's a really unique part of training in New York. Just in addition to the really great social life you have here too, because there's so much good food in New York. I think we have the best food in the world. There's also Broadway. There's great nightlife. Nothing ever closes. So if you have the opportunity to visit New York or train in New York, I would really recommend it. I would just say bring a lot of winter clothes because it has been cold. Other than that, I think that's it for questions. So I'm going to turn it back over to Kyle. Thank you guys so much. Really appreciate it. And I'm going to drop my number down here also so that if anyone has any questions about medicine, about being pre-med, please don't hesitate to reach out.
Awesome. Thank you again for joining all the way on the East Coast where it is almost 11 p.m. And I'm assuming you have to wake up at like 4 a.m. or something for clinic or yeah. Yeah, thank you very much. And yeah, everyone, like we hope to see you again next month. We see the phone number in the chat, and then Michelle's email is also available on the dialogue schedule if you ever want to contact. And yeah, thank you everyone for coming, and thank you for a great presentation and Q&A.